My name is Martin Gerdes, and I'm from Long Island, New York. My presentation today dealt with low thyroid function in an animal model of diabetes. The animals actually had normal serum thyroid levels, but what we found was that their cardiac tissue levels were severely depressed. They had cardiac tissue hypothyroidism, and as a result of that, the diabetic rats had a loss of small arterioles, about 25% loss of small arterioles, and they had severely impaired systolic and diastolic function. We treated them with an oral dose of T3, and the whole idea was to do this therapeutically. We treated with an oral dose of T3, and we looked for feedback inhibition of TSH and T4, mild. And we had just a slight but insignificant increase in serum T3. So all of the thyroid hormones were in the normal range. And again, the animals were, at least serum diagnosis, they were not hypothyroid. But when we examined the tissue levels, we found that the cardiac tissue levels in the diabetic rats was about 40% below normal. And we know from our past experience that this is enough of a depression of the tissue T3 levels that can actually cause heart failure eventually by itself. And the T3 treatment group, it completely restored the cardiac T3 levels without significantly elevating serum thyroid hormone levels. So the exciting thing about this now is that we have a clinical protocol. We have an approach for the first time that we can go directly to the patients with for treatment, therapeutic thyroid treatment and monitoring. It is a bit scary that these animals had no serum diagnosed thyroid dysfunction, and yet their heart was severely hypothyroid. And as a result of thyroid treatment, it literally eliminated all of the cardiac disease. The blood vessel loss was prevented. The impairment of contraction and relaxation were also prevented by thyroid hormone treatment. So I think the implications of this study are quite remarkable and certainly clinically relevant. There is a lot of data from the literature that suggests that we do know that diabetic patients have a much higher incidence of low thyroid function. It's about 6 times the rate of the normal population. So there is very good reason to believe that the same kind of thing is going on in diabetic patients. So we're very optimistic that this will result in important clinical breakthroughs in the very near future.